This conversation is powered by Google Illuminate. Check out illuminate.google.com for more. So AI is supposedly revolutionizing drug discovery. Sounds like science fiction, right? But this article claims it's happening now. What do you think?
It does sound wild, but the article mentions some pretty impressive stuff, like designing a drug in 18 months instead of years. That's a game changer.
18 months, that's faster than it takes me to decide what to have for dinner. Seriously, though, is it all hype or is there real progress?
I think there's a real shift happening. The article highlights how AI can spot connections humans might miss, leading to more innovative approaches.
So are we talking robots replacing scientists? Or is it more of a collaborative effort? The article emphasizes the speed aspect, developing drugs in months instead of years.
Yeah.
That's a huge leap, right?
Absolutely. Think of the lives that could be saved by getting treatments to patients faster. And the cost savings are massive, too. Billions saved.
Billions. That's enough money to buy a small island, maybe even a large one. But what about the quality of these AI-designed drugs?
That's a valid concern. The article points out that human expertise is still crucial for validation. It's not a case of replacing scientists, but augmenting their abilities.
So it's like giving scientists superpowers, a helpful AI sidekick. That's a pretty cool image. The article also mentions some challenges, data limitations, for example. What's the deal with that?
AI models need tons of high-quality data to work effectively, and in medical research, that data can be scarce and sometimes unreliable. It's a bit like trying to build a house with incomplete blueprints.
Incomplete blueprints? That sounds like a recipe for disaster.
Yeah,
And what about the clinical trials? The article mentions that as a major hurdle.
Exactly. Even if AI designs a promising drug, it still needs to pass rigorous clinical trials to prove its safety and effectiveness. That's the ultimate test.
So it's not a magic bullet, but a powerful tool that still needs careful handling, right? Looking ahead, what does the future hold for AI in drug discovery? The article mentions personalized medicine.
Personalized medicine is a huge potential. Imagine treatments tailored to your specific genetic makeup. That's a level of precision we've never had before.
That's mind-blowing. And what about the cost of healthcare? The article suggests AI could make it more affordable.
Absolutely. By streamlining the drug development process and reducing costs, AI could make life-saving drugs accessible to more people.
So a win-win situation. Faster cures, personalized treatments, and lower costs. Sounds almost too good to be true. The article mentions in silico medicine and their work on a drug for IPF. That's pretty impressive, isn't it?
Incredibly so. Developing a potential treatment for a rare disease like IPF in just 18 months is a testament to the power of AI.
And what about Recursion Pharmaceuticals? They're tackling the data limitations head-on, right?
Yes, they're using supercomputers to generate their own data, which is a clever approach to address the data scarcity issue.
It's like creating their own data factory. That's innovative thinking.
Yeah.
There's bound to be skepticism about AI in medicine. How do we address those concerns?
Transparency and rigorous testing are key. We need to ensure that AI models are developed and used responsibly with appropriate human oversight.
So it's not about replacing human judgment, but enhancing it. That's a crucial point.
Precisely. It's a collaborative effort between humans and machines. The article emphasizes that point well.
It's a partnership, not a takeover. The article highlights the potential for AI to accelerate cures for rare diseases. That's a huge deal, isn't it?
Absolutely. Many rare diseases have been neglected due to the high cost and complexity of drug development. AI could change that.
In personalized medicine, that's another area with enormous potential.
Yes, tailoring treatments to individual patients based on their genetic profiles could revolutionize healthcare. It's the future of medicine.
It's like having a custom-made drug just for you.
Mm-hmm.
That's amazing. The article emphasizes the collaboration between scientists and AI. How do you see that playing out in the future?
I think we'll see a seamless integration. Scientists will use AI tools to accelerate their research, while AI will learn from the insights and expertise of scientists.
A symbiotic relationship. It's not a competition, but a partnership.
Exactly. It's about leveraging the strengths of both humans and machines to achieve breakthroughs in drug discovery.
A powerful combination. What about the ethical considerations? Are there any potential downsides to using AI in drug discovery?
Of course. Bias in data sets is a major concern. We need to ensure that AI models are trained on diverse and representative data to avoid perpetuating inequality.
That's a critical point. We don't want AI to exacerbate existing health disparity.
Absolutely. And we need to be mindful of the potential for misuse or misinterpretation of AI-generated results.
Ethical considerations are paramount. Looking at the bigger picture, how will AI transform the future of healthcare?
I think it will be transformative. AI has the potential to accelerate drug discovery, improve diagnostics, and personalize treatments, leading to better health outcomes for everyone.
A brighter future for healthcare. That's a positive outlook.
It's a hopeful vision, but it requires careful planning, responsible development, and ongoing evaluation.
It's a journey, not a destination. That was a great discussion. And a big thanks to Jay Poole and their AI collaborator for the insightful article from Tech Frontiers YouTube. It really sparked some interesting thoughts.
My pleasure. It's a fascinating field, and I'm excited to see what the future holds.
Me too. Thanks for joining me.